So hello guys, welcome to the new video. Today we will be studying about anti-tuberculosis drug. Okay, anti-tubercular drug. So what is TB? TB is basically a chronic infection caused by mycobacterium. Let me write it full. Mycobacterium tuberculosis. Okay, it is the most common infection in India. Okay, then it can spread to any organ. Okay, like the intestines, then the lungs. Okay, now in studying TB, so since it is a chronic infection, it includes many necrosis and the accumulation of fibrous tissue. Okay, so we have to cure that TB as soon as possible. Okay, when it is diagnosed, it has to be cured. Now while studying about TB, we will be not studying about any specific classes of drugs, like any classification of drugs. Okay, the classes of drugs are not classified. We have drugs from many classes of drugs. Okay, so the classification will be mostly the first line and the second line. Okay, the oldest classification. Okay, first line and second line. So let me just write it. First line. Okay, first line drugs. Now we have studied that first line drugs consist of 4 drugs: H, R, Z and E. Okay, H stands for isoniazid. Then R stands for rifampin. Okay, then Z stands for pyrazinamide, and E stands for ethambutol. Okay, so these are the first line drugs. Now the second line drugs. We have many drugs in this second line drugs. Okay, we have PAS, para amino salicylic acid. Para amino salicylic acid, in short form we call it as PAS. Then we have levofloxacin. Okay, we have ofloxacin. Then we have clarithromycin. Then we have moxifloxacin. Okay, we have kanamycin. Then we have ethionamide, and much more drugs in this class. Okay, so first we will start with first line drugs with the drug isoniazid. Okay, we will start with isoniazid. So the mechanism of action of isoniazid. What is the mechanism of action of isoniazid? So basically isoniazid is a prodrug. Okay, let me just mention it here. It is a prodrug. Okay, now when it goes in the body, okay, it gets converted to active form by catalase peroxidase. The peroxidase enzyme convert this isoniazid in its active form. Now once it is converted to the active form, what it do? The active form, it binds to NAD complex. Okay, and forms another complex. Okay, now what does this signifies? So this basically further leads to inhibition of Cas-A and INHA enzymes. So what is the importance of inhibition of these enzymes? So basically these enzymes are involved in the synthesis of mycolic acid. So we have inhibition of mycolic acid synthesis, and we know mycolic acid is present in the cell walls, okay, of bacteria. Now if there is no mycolic acid synthesis, the cell wall of the bacteria will not be formed and death of bacteria will occur. Okay, so the mechanism of action is, it is a prodrug isoniazide. It gets converted to its active form by catalase peroxidase. Once it gets converted to its activated form, it go and binds to NAD complex. Then it leads to the inhibition of Cas-A and INHA enzymes. These enzymes are involved in the synthesis of mycolic acid. So the mycolic acid synthesis is arrested and it leads to the death of the bacteria. Okay, this is the mechanism of action of isoniazide. Now an alternate mechanism, it inhibits folate synthesis, and we know folate synthesis is required for DNA synthesis. How it inhibits folate synthesis? By inhibiting folate reductase enzyme. Okay, folate reductase enzyme is inhibited, so folate is not formed, which is required for DNA synthesis. So in the mechanism of action, we understand two things. Which two things? That this isoniazid drug is acting on the cell wall and the DNA. Okay, and it is a prodrug. So this was the mechanism of action. Now coming to the pharmacokinetics of the drug. Okay, pharmacokinetics. So it is an oral drug. Okay, it is well absorbed in the gut. Okay, it is well distributed. Okay, it is metabolized by acetylation and excreted in urine. Okay, now these are the pharmacokinetics. It is the oral drug, well absorbed in the guts. Okay, it is well distributed in the gut, metabolized by acetylation, and it is excreted in urine. Now coming to the adverse effects. Now as we have seen that it is metabolized by acetylation, it goes to the liver for acetylation. So the adverse effect, number one adverse effect will be hepatotoxic. Okay, since it is metabolized by liver. Okay, now tell me one thing. If it is a chronic alcoholic suffering from TB, will we give isoniazide? No, because chronic alcoholic is already suffering from liver failure. Okay, so chronic alcoholic risk increases in chronic alcoholics and old patients, elderly patients. Okay, patients should be monitored. for symptoms such as, what first symptom comes to your mind when we talk about liver? Yes, jaundice. Then also common symptoms like nausea, vomiting. Okay, so isoniazid, one of the adverse effect is hepatotoxic. Second is peripheral neuritis. Okay, then we have fever, we have some rashes, skin rashes, we have anemia too. Okay, so this was all about isoniazid. Okay, we started with the mechanism of action, acting on the DNA and the cell wall. Then we talked about pharmacokinetics. Then we talk about adverse effects. Okay, now coming to the second drug, the R, rifampin. Okay, now many get confused with rifampin and rifampicin. So the first point itself says rifampin is a derivative. Okay, it is a derivative of rifampicin. Rifampicin. Okay, now the drug mechanism of action of this drug. Okay, we will come to this mechanism of action. So it is very simple. It binds, this drug binds to DNA dependent RNA polymerase. Okay, it binds to DNA dependent RNA polymerase. So where it is used, this DNA dependent RNA polymerase? Yes, it is used in RNA synthesis. So if there is no RNA synthesis, it will ultimately lead to bacterial death. No RNA synthesis, and finally bacterial death. Okay, now the pharmacokinetics. This was all about the mechanism of action. It binds to DNA dependent RNA polymerase, which inhibits the RNA synthesis, and it will further lead to bacterial death. Okay, the pharmacokinetics. So it is an oral drug. It is rapidly absorbed from the GIT. Okay, absorbed and widely distributed. Okay, it is also metabolized by liver. Okay, and excreted in urine. Okay, now one point to note, the deacylated form enters bile and participates in enterohepatic circulation, and this form is active form. Okay, so this deacylated active form, it enters the bile and it participates in the enterohepatic circulation. So what is the benefit of this enterohepatic circulation participation? The drug acting will be like the duration of action will be prolonged. Now going to the uses. Okay, this rifampin is used in many diseases. Okay, first is to TB, second is leprosy, okay, both possibacilli and multibacilli. Then we have prophylaxis of meningococcal meningitis and H influenza. Also, it is used in treatment of brucellosis with doxycycline. Okay, now the adverse effect. Now, since it is metabolized by liver, the adverse effect is hepatitis. Okay, the main adverse effect. Okay, and as we know, in alcoholics and in old patient or elderly patient, the risk increases. Okay, second is flu with associated symptoms like chills, headache, pain, muscle pain, then joint pain. Okay, then GI disturbances such as nausea, vomiting, abdominal discomfort, diarrhea. Okay, then as usual we have rashes. Okay, now one point to be noted, it is a enzyme inducer drug. Okay, since it is an enzyme inducer drug, it increases metabolism of many drugs. Okay, so it reduces plasma levels of drug. Okay, and what is the significance of this? It is contraindicated when there is a therapy going on, or the therapy will not be an appropriate word. It is contraindicated when there is contraceptive therapy, okay, or contraceptive going on. Okay, it will decrease the plasma levels of the contraceptive and will ultimately lead to contraceptive failure. Okay, now going to the next drug, Z, pyrazinamide. Okay, so the mechanism of action of pyrazinamide. Okay, what is the mechanism of action? So it inhibits the fatty acid synthesis. Okay, fatty acid synthase complex. Okay, fatty acid synthase. So what it will do? It will inhibit the mycolic acid synthesis. And remember, where it is mycolic acid synthesis? Bacterial cell wall. So bacterial cell wall synthesis will be inhibited and it will lead to bacterial death. Okay, this is the mechanism of action of pyrazinamide. Now coming to the pharmacokinetics. So it is an oral drug. It is well absorbed, okay, and widely distributed. And one point to be noted, it is active in acidic pH. So it will be very well absorbed in that GIT. Okay, now the adverse effect. Okay, adverse effect will be it leads, like it impairs the excretion of urates. Okay? Impairs excretion of urates, therefore it lead to hyperuricemia. Okay, 2 points to be noted. They are common points, but we should write it is metabolized by liver. Okay, excreted in urine as the other drugs. So excreted urine, so it impairs excretion of urates and it will lead to hyperuricemia, and hyperuricemia will lead to gout. Okay, then anorexia, we have nausea, we have vomiting, we have skin rashes, okay, etc, etc. So this was all about pyrazinamide, a short drug which inhibits the fatty acid synthase complex, and it will lead to inhibition of mycolic acid synthesis and bacterial cell wall synthesis, and it will lead to cell death. Now coming to the last first line drug, ethambutol. Okay, what is the mechanism of just a second. Now the mechanism of action of ethambutol is very interesting. So why it is interesting? So it inhibits arabinosyl transferase enzyme. Okay, so what does this arabinol transferase inhibition will cause? It will inhibit synthesis of arabinogalactan. Okay, now if synthesis of arabinogalactan is not there, what will be the cause? So it will lead to bacterial death. Now why? The main question, why? So the arabinogalactan is used as a connection between mycolic acid and peptidoglycan, which ultimately leads to formation of cell wall. So you have the answer now. If there is no synthesis of arabinogalactan, it will lead to the loss of connection between the peptidoglycan and mycolic acid. So therefore it leads to disruption of the cell wall, and it will lead to the bacterial death. Okay, now coming to the pharmacokinetics. The pharmacokinetics says it is an oral drug, then it is well absorbed and distributed. Okay, it is metabolized by liver. It is excreted in urine. Okay, now, and one more point, it is crossing the blood-brain barrier. So it crosses the blood-brain barrier. Now the adverse effect. The adverse effect says the main adverse effect, optic neuritis. It is the main adverse effect. Okay, and it leads to decreased visual acuity and also decreased color vision, red green defect. Okay, red green defect. So a periodic eye examination is suggested for patient on ethambutol. Okay, it has many ophthalmic side effects, ophthalmic adverse effects. Okay, now one more adverse effect is hyperuricemia. Main is optic side effects, adverse effect, but we have hyperuricemia too. Then we have abdominal pain, we have rashes, we have nausea, and etc, etc. So this is all about the first line drug. Now we will be heading to the second line drug, but first we will be making a summary of these 4 drugs, a short table of summary. So this was all about the first line drugs.